Okay, welcome back everyone to the August Digital Health Virtual Program. We now have a very exciting session on budgeting for tech investments, a conversation on how tech dollars are being invested in 2022. This session is being brought to us by our friends at Wellframe. A big thank you to them. As a reminder, if you have any questions of our speaker faculty today, please submit them by using the chat functionality within the Zoom platform. I think I'd now like to welcome back Mark Hagland, our editor-in-chief, who will be our moderator for this next session. Mark, take it away.
Thank you so much, Matt. Great to have all of you with us, either in the moment or virtually. I love to say welcome to people in the future. Welcome to our session. I am so pleased to have Susan Beaton here with us today from Wellframe. She brings a wealth of experience. And in fact, we were talking in our virtual green room a little bit about it, and I want to have her reference it. Susan was practicing RN, and then she spent years at Blue Cross Blue Shield of Nebraska before coming to Wellframe. And we're going to talk about health plans investing in technology. But first, welcome, Susan. And can you just spend about 2 minutes telling us about yourself? You have a wonderful background and narrative.
Appreciate it. Thank you. Well, welcome everybody. Again, I'm Susan Beaton. Today I'm the Health Plan Vice President of Strategy at Wellframe. Again, as you mentioned, a nurse by training, spent a lot of years doing that before heading to the health plan and business side. So the conversation today is near and dear to my heart. I love technology. I love how it can advance nursing. I love how it can advance the member experience and then also be a benefit as a whole for a health plan and an organization. So bringing all of those years of being member first, being patient first, but then also knowing all of the information health plans have at their fingertips from products and benefits and claims and care managers and member experience, knowing that technology now, as you say, looking to the future, can really help health plans even have a better member experience. So I'm excited to really use all of the years of service as well as now looking at technology to advance that experience and have that conversation today. So I appreciate you having me.
Absolutely. And when I say you have many years of experience, I know you began in the womb.
Yeah.
Very, very youthful. So Susan, tell me, why don't we start at 40,000 feet up and then we'll, descend in increments of 5 to 10,000 feet. But at that 40,000 foot up view, what does the landscape look like right now for health plans in terms of investing in technology? We're in such an interesting moment. I think this moment with regard to the pandemic in particular, we're learning things. No one wanted a global pandemic. I keep metaphorizing and comparing it to like when the meteor hit the Yucatan. Hopefully we won't all, be extinct because of it. But obviously it shook everybody's world, like literally the world of the whole world. Yeah. One of the things that I find interesting in healthcare is it kind of has forced us to think about our priorities. It's forced us to think about our preparedness for a variety of situations. Health plans have been good, I think, in investing in technology. In some ways, they've been ahead of providers. But I also think that the pandemic opened our eyes to some gaps and areas where we could improve. What are your thoughts on that? Where would you like to go with that?
Yeah, so I'll start with one simple thing to start and then kind of expand on it a little bit and this is just even from my current role and my past role as a health plan executive, was that health plans want to and need to still own their member experience. That's first and foremost. And technology now is going to allow them to do that and to do it even better, right? And to build upon that. And I think what's changing now when you think about the 40,000 foot is now, business leaders, clinical leaders at a health plan alongside their CIOs and CFOs are having conversations about setting strategies. And that includes digital and technology strategies, because that's what's now going to drive that member experience. And so the conversations they're having are investments in technology, but now it's a lot of those leaders at a health plan around the table having those conversations. But it spurs the conversation, and the thought is, do we build it ourselves? Do we partner? Do we buy something? And then depending on that, how are we going to implement that across the organization? And health plans, in order to still own that member experience, then they don't want to lose or outsource that customer service or that nursing or clinical service to a competitor. You don't want to do that. And that often adds confusion to the member's experience, and that adds to it. So many times health plans have to sit down and look at, what does it mean to build more of a digital member experience, build on the technologies that they have, and focus outside of what their core is, which is usually claims processing or calls.
Yeah.
And so I think that's at the 40,000 foot level, is how you're seeing different health plan executives now at the same organization coming together to look at how are they going to do that? What are they going to invest in? And to your point, is a pandemic has now made them look at things outside of, maybe not focusing on just state and federal mandates and how do you put that into a product or claims. It's now, I need to engage my members. I need to do it at scale and with efficiency. So you're exactly right that this last year and a half, we've actually seen them pivot and do a really good job, during this pandemic, in responding to it and identifying ways to engage their members better. So now we have to keep the laser focus on it at that 40,000 feet. We can't let them stop innovating. They need to keep moving forward. And I think that's going to be the turning point for a lot of these health plans, is the urgency is there now. They don't have 5 or 10 years. They don't even have 3 to 5 years to implement their health plan strategies. They're going to have to move forward now.
Yeah, exactly. If I may draw a metaphor or an analogy, one of the things that I see when I look at providers and plans, I see a real strong commonality. And where I see that is for providers, for hospitals, a lot of hospital executives are still thinking about, how do we fill beds, right? Like, that's their mentality, even though they'll disown that. They'll say, well, no, we're really thinking about the total patient across the continuum care, blah, blah, blah. For health plans, the traditional health plan leader is still just thinking about claims processing, claims management, utilization management, things like that. What is the new world that we should be investing in? I know part of that is population health, part of it is member engagement, part of it is care management. What does that look like to you on a high level? And then we'll talk about connecting that to technology investment.
I think it's interesting. I think health plans and providers are actually sharing more of the same common goal than they have in the past, for different reasons. One, health plans and providers now are on sometimes the same team. One, the health plan may purchase a provider or a hospital. And if they don't do it that way, then they do have a great relationship in their value-based care. So whether it's through patient-centered medical homes or accountable care organizations, they're now focusing and sharing the same whole person care, right? So health plans have all of the data and insights on their members, and now they're sharing it with providers. So even outside of technology, is they're using all of the insights that they have. They were, health plans are best equipped to offer that member and patient experience and insights, but they can do it on the provider side as well. So to your point, the hospitals and providers maybe are shifting from some of it to not just filling the hospital bed, but along with their partnerships with the health plan, where could these services be offered somewhere else or in the home? And then now, to your point, comes the technology. How do we all share the same communication platforms so we're all on the same page to make sure those services get done?
Yeah, and so it's really about the wraparound experience for the plan member, right?
Yes.
Or that's a part of it, right?
Yeah.
So now let's talk about investment. Before we talk about types, how should health plan leaders think about technological investment in general, right? Like, one of the problems on the provider side is what will typically happen, and no one wants to own up to this, of course, no one will admit this. The people at hospital A hear that the people at hospital B did something. Did you hear that the people at hospital B bought blah, blah, blah? We have to go out and buy blah, blah, blah because the people at hospital B bought it. Do health plan members sometimes fall into that too? They hear that health plan B acquired technology, so they're going to do it rather than thinking very strategically about what it is they need to do?
No, I don't, are you thinking about health plan members? Do they think that way?
No. Do health plan executives think that way?
I think you have to, right? So first and foremost, you still have to offer a competitive product, right, in your market. So when you're going out, whether you're selling to an individual consumer on the exchange, or whether you have employer groups, right, or brokers that are asking for technology to engage their employees. So that's always first and foremost, whether it's on, a health plan side, or, a provider side, is making sure they both have the best member experience or patient experience to offer. And to your point, that now means, it used to be customer service, great customer service, or phone calls, or how fast did you offer, a member, to answer the phone about their question. And so now it's about, how do you look at a whole member experience and treat the whole, person at the same time? And so you have to be able to have technology to do that. Members expect that today. They want that same type of Amazon type feel from a health plan or from a provider that they get in their normal life. So yeah, competition, you have to offer the services that your members are wanting.
Absolutely. So what broad areas do you think that health plans need to invest in now if they haven't yet?
That's a good question. I think looking forward, I think we saw this with the shift with COVID, that health plans now really, they're more well positioned than ever in adopting those technologies, right? And providing that personalized support. And they do recognize they have to be able to change the way that they offer all of their insights and information to their members, right? So I think with all the information they have at their fingertips, they're financially motivated to do that. They have the data to do that. They have infrastructure. And so now they have to be able to deploy technologies in order to do that. And so I think when they look at what it takes to provide a true whole member person care, they have to think about it. They spend a lot of times on member journeys. And so when you think across that spectrum, how am I going to make that member journey seamless and frictionless? That's when technology comes in. That's when investments in digital comes in, so that they're able to deliver on that and really offer that. So I think first you're going to see that switch to, they're going to have to be digital first health plans. They have competition, as you noted, right, and asked about, that's coming in, that are new entrants to the market that don't have old legacy mindsets or systems, but are now competition, where they're going to have to now also meet those same type of demands, because they don't want to or need to outsource those type of services. They are a trusted partner to their members, just like a provider is a trusted partner to a patient. So there's a huge opportunity for that.
Absolutely. So I'm hearing member engagement, also care management for members with chronic illness. And I know, of course, there's tremendous opportunity in claims management, claims processing. Are there any other broad areas I'm missing?
I think they actually all tie in together, right? I think all of them, because when a member first experiences their health plan, it's usually through their benefits, and then they have questions, right? They will always have a question about a benefit, and then that benefit turns into a claim. And then if they become sick, right? So even if it's out of, let's say, preventative services, or what benefits do I have, then they're going to need a nurse care manager. And so we need to figure out a way using technology, is how do you help that member walk through the health plan, whether it's a benefit question, a claim question, or a care management need, all at the same time and very seamless and very easily. And technology can now do that for health plans. You don't have to have a separate number to call for each experience now. So I think that's the opportunity that they're moving forward on.
That makes sense. Now, I'm going to ask a question that can't be answered. How's that?
I'm going to try.
Okay.
I like a good challenge.
Okay. So how do we think about spending, right? And what I mean, obviously, I'm not going to say, you should spend $1,251,437. That's not where I'm going. How do you kind of strategically think about spending, right? Let's say you identify 3 main areas of opportunity, and you say, these are kind of the areas we're going to focus on. How do you get to that next level of thinking about investment?
Yeah, I think, I mentioned earlier about one is I think you're going to see more health plans actually break down the leadership silos even within the organizations. For a lot of times, each executive may have run their own business units and each had a product to run or a product to offer a member. You're now seeing all of those leaders come together about where are our investments going to be. And you have to think about digital in that same way, is where is the most impact? Where can we start? Here's our strategy now. Here's where we need to be though. And here's what our empowered consumers now are asking from us. And so I think really as you have those leaders sit down and have those conversations and set that strategy, it becomes less of a challenge. And I think they have to look at what do we look at and invest in right now to actually get us moving, and what is actually going to be transformational in a year or 2 years or 3 years.
So it's really strategic prioritization.
It is. And then what do we have that we can already use? What isn't going to work right in the environment that we need in 1 or 2 years? And so I think you look at is you have, what's our time frame too for accomplishing these initiatives? And it's compressed now, right? Look at what COVID's done. Look at the other market competitors that are entering the health plan space, the Amazons, all of those things. So now it's compressed where you used to be able to set a strategy for 10 years. You can't. It's now, what's 1 year, what's 3 years. But this is where health plans now look at it as, back to that earlier point, build, buy, or partner. They may not be able to build like they used to, right? When you focused on building claims systems or enhancing that or customer service, you could build something maybe every few years, but now you have to maintain it, and technology changes too fast now, right? There's always something new to offer as a digital asset that now it becomes, we're not going to just build it ourselves. It's a good opportunity to partner and scale, and you can do it faster. So that compressed timeline, you can meet the needs of your consumers.
So you're saying that part of the calculus has changed now because of the compressed timelines, right? So that maybe 10 years ago, build would have made sense in certain areas, but really it's going to come down to buy or partner in a lot of cases. Is that what you're saying?
Yeah, because then they can take their core infrastructure, right? That might still be legacy, but now with the way capabilities are from IT, you can hook up through APIs and FHIR, you hear all these words, right? Is how do you then with your partner connect to maybe your current systems? You're not having to reinvent everything. And now it's about connectivity and technology and using those partnerships in order to scale faster and effectively and efficiently.
Okay.
Yeah.
So how do you think about choosing technology partners? What are the key process questions you should ask?
I would say one that I looked at as a health plan executive was not only technology, is actually how they were as a partner. I didn't want just a vendor. I wanted somebody who was going to partner with me, because a lot of it, when you bring in technology or digital assets or new tools into an organization or a health plan, change management has to come with that. Breaking down silos has to come with that. And so you have to be able to have a partner, one that, yes, has the technology to do what you need, support it. And by support, I mean, keep up with technology and demands. To your earlier question about competition and bringing in new things, is I now have to keep up with that. So my technology partner has to do that, and it has to be best in class. But so does their business relationships as well, and moving me forward on a business side.
Well, I certainly agree with that. How do you determine between organization A and organization B that organization A is going to be a partner and organization B isn't before you sign on the dotted line?
Yeah, that's a great question. A lot of time it is spent, outside of an RFP that health plans usually send out about technology, or can they do certain tasks, or do you offer certain services? That might get down to the nuts and bolts. But after that, I'm going to have a conversation with those executive leaders. And I'm going to also meet with other clients and customers. And I want to look at outputs.
Yeah.
But, I think the other thing is some vendors can put numbers together that are numbers, and numbers can say a lot of different things and what they want them to say. And so I think that's where picking the right partner for business and technology, but then also talking to their customers and looking at their outcomes and member engagement and how they do this, and how do they move their organizations that they already currently partner with forward. That's what I'm also going to look outside of technology. A lot of people can hook up technology, but what I want is a partner who can actually deliver on that and keep moving me forward.
Yeah. And let's talk for just a minute about one of the things that seems obvious, both on the plan side and the provider side, is an organization is going to have to be a partner for more than 1 year, right? Like partnership, providers are very much in this dilemma because there are startups and organizations, vendors doing all sorts of fascinating things, but you do wonder in some cases, are they going to be around, right? Like that's a huge thing. For example, one area, and I know this also applies to health plans, AI, right? AI and machine learning are so exciting, but it's a wild west out there. So in areas like that, where it's really hard to know, there are like tons of startups and semi-startups. I mean, they've been around for a year or two, but they're still, they're like a 4-year-old or something, right? So how do you think through when you're doing the dating game or whatever they call it, because you were a health plan executive for so many years, a couple of tips for us on that.
So that's actually a great question. And I can actually share with you how we did just that. And part of it was actually, as I introduced myself and as you introduced me, working for Wellframe. So we've been around since 2012. We were a startup. And actually at Nebraska Blue as an executive, which a lot of health plans have innovation arms. They have innovation companies also on the side. We actually brought Wellframe in through the innovation company because I needed to modernize the services that we had in technology. And it goes back to our build, partner, buy. And I knew I couldn't do it quick enough by ourselves. I couldn't maintain it. Even if I could get my IT teams to build it, I would have to sit in a backlog of work every year to get upgrades done. And so I needed the best in class. I needed technology and I needed a good partner. And it happened to be a very early on tech-enabled, innovative company. Yeah. And now it's 7 years, 8 years later, and we're here and we've grown and done all of those things. And to your point, we've now earned AI. And when you look at using data outside of just the health plan claims, outside of just calls, you need to be able to have data from that digital asset and engagement to know more about your member. So health plans today already have a lot of that data internally, but it's claims-based. I need real-time, engagement and information. And so I think that's the things that you also look at. You shouldn't be afraid of innovation. We're asking health plans to innovate now. They're not usually having to do that. They usually deal with mandates and building products that take 18 months or technology to support it, but they're not moving at the scale and pace of other innovative companies. They just haven't had to do that. But now they can by partnering. And so I think that's the huge piece of an opportunity that they need to look at for member engagement, as there is a new normal and there's a new reality for health plans that's necessitating member facing tools that mirror the same experience consumers have elsewhere in their lives. And so we shouldn't shy away from that. Innovation is necessary and it keeps moving us forward.
Absolutely. So I'm going to ask you to kind of summarize everything you said is implicit advice, which is great. If you could just kind of give us your top several enumerated pieces of advice, and then I'll ask you one last question, but go ahead with that. Please.
Okay, so I would say, even coming from the health plan executive side too, and now being even the technology side, and a mix of both of them for the last 7 years and experiencing it firsthand myself, is that payers increasingly realize that significant change is necessary, right, to bolster their member engagement. So that means my top things is they will need a modern approach. And that requires modern infrastructure and technology, which many health plans have tried, but in many cases, they may have been unable to adapt to that current moment. So as a health plan organization, and this goes back to your question earlier, sit down as leaders within the organization, invest in technology and innovation through partnerships if they need to do that, to fit into what their member experience should be and digital strategy, and not to wait 3 to 5 years to enact that strategy. It's as you're building it, you need to start doing it. And so I always talk about build, measure, learn, repeat, and you have to be agile. You have to do it in real time, and not to be afraid of that, and to pick the partner. To your point, is how do you pick that partner that's going to help you iterate and learn. But that's where health plans needs to also challenge, is it can't be perfect from the get-go, and it won't be. And members really aren't expecting that. They just want to have an experience that's just like every other part of their life. And that means digital first.
Absolutely. Yeah. And I love that you brought in the concept of agility, because I think if there's anything that everyone across all sectors of healthcare is going to have to be, it's agile going forward, right?
And health plans and providers, even though we're talking about and asking them to rethink what technology and digital experience looks like to them, right? From what their core principles are today to the future, and scrutinize their investments, both providers and health plans are poised for success. They really are. And it's now what their consumers are asking for. And they've always risen to that challenge. And we've seen them do it the last year and a half. It's now they just can't do it by themselves. There just isn't time or financial availability to do that as well.
Absolutely.
Yeah.
So what do the next couple of years look like in this space to you?
I hope, to your point, early question, that it continues to be innovative, that they continue to adopt the mindset of build, measure, learn, repeat, that they're not afraid of that innovation in AI and all those things that can help them actually know what their members and patients want and need. I think it is an exciting time to invest in those partnerships and technology. And technology is here to stay. We were talking in our offline chat about interoperability and how even CMS is investing in that, in the technologies and what that's going to look like. To me, that's exciting to do that. And so health plans will still be there. They're going to look a little bit different, engaging their members, same with providers, and more of a partnership. But now sitting at that table is the partnership of technology and those partners who can bring that to the table, and recognizing that it just can't be done alone. Again, that scalability needs to be there.
And I think we'll all have to be partners with everyone, right? Health plans and providers are finally truly partnering around population health care management. And they need the technology partners to help them be successful in their health plan provider partnerships.
They do. I think they all recognize digital business transformation is necessary and optimization to get started. So I think those health plans and providers that will continue to seek that and push that enterprise beyond its current business model will continue to be successful.
Wonderful. Well, this has been such a great conversation, Susan. We so appreciate it. And I appreciate your leadership in healthcare.
Appreciate it. You bet. I apologize for my little scratchy voice there with my allergies, but this has been a good conversation. And I hope it's one that many are having across the healthcare industry.
I didn't even notice your voice. It was what you said that was important. Thank you so much, Susan. It's been really great. And Matt Rayner has returned to help conclude our session. Thank you.
Yes, and thank you, Mark, and thank you, Susan. A really great conversation on budgeting for tech investments. I do want to thank again our three partners who allowed us the opportunity to put on today's program: Change Healthcare, Wellframe, and Spectrum Enterprise. Looking ahead, I want to let everyone know that on September the 15th, we will host our September Digital Health Virtual Program. That will be on the future of interoperability, which we were just talking about. So a day filled with sessions all about interoperability. Should be fun. You can learn more right on our website at hcinnovationgroup.com. With that said, I would like to thank you all again for being a part of this program, whether you are watching today with us here live or consuming this content on demand. A big thank you. And we look forward to collaborating again with you all very soon. Thank you so much.
Thank you.
Thank you.